Hi, I'm Dr. Dan Lieberman. I'm a psychiatrist, a clinical professor of psychiatry, and the SVP of Mental Health at Hims & Hers. Prozac is the brand name for the antidepressant fluoxetine. It's used to treat a variety of mental illnesses, including depression, anxiety, premenstrual dysphoric disorder, and obsessive-compulsive disorder. It belongs to a class of medications called SSRIs, serotonin-specific reuptake inhibitors, and as the name suggests, it acts on the neurotransmitter serotonin. Prozac is one of the most frequently prescribed medications in the United States today. Prozac works by increasing the activity of serotonin. It blocks the removal of serotonin from the brain, and that leads to a stronger signal. As a result, we get more serotonin stimulation, which leads to a cascade of events, eventually leading to the resolution of symptoms of depression and anxiety. Prozac is usually started at a dose of 20 milligrams. If somebody's having a lot of anxiety or panic attacks, it might be started at 10 instead, because during the first few days, Prozac can cause a little bit of activation, a little bit like a cup of coffee. After 4 weeks, if it's not doing everything it needs to be, the dose can be increased progressively up to 60, sometimes 80 milligrams. Prozac can have side effects that occur early on and generally resolve, and then there's side effects that tend to be a little bit more enduring. Early on, some people experience nausea, and it tends to be pretty mild, maybe the way you might feel after getting off of a bumpy plane ride. For some people, it can be much worse, but that's less common. Early on, Prozac can cause sleepiness, it can cause restlessness, it can cause that activation I mentioned, as if you might have had a little bit too much caffeine. Prozac can cause headaches early on, and you can just kind of feel off as if you have a mild cold. These generally go away in a few days. Now, the most troublesome side effect with Prozac, one that generally doesn't go away unless it's treated, are the sexual side effects. These include loss of interest in sex and difficulty reaching climax. If you are in a sexual relationship, it's very important to tell your partner about the possibility of these side effects. Prozac can cause other side effects, although they're less common. If you have anything that you find uncomfortable, the best thing to do is talk to your provider. All antidepressants have a black box warning because during the clinical trials, it seemed like there might have been a signal of increased suicidality among young people under the age of 25. It's controversial though, and some people think it was a result of a faulty statistical analysis. Whatever the truth may be, depression causes suicide, and you should never avoid treating your depression because of things like a black box warning. That's a difficult question. We don't have a lot of data to answer it, but I always recommend to my patients that if an antidepressant is working, they continue taking it. There doesn't seem to be a large risk of congenital malformations with Prozac, although there can be complications around the time of birth. The thing is, untreated depression also can cause complications in pregnancy, and it can affect a child's development later in life. Most providers agree, if an antidepressant is working and a woman becomes pregnant, she should continue to take it. The most important thing, though, is to coordinate care with your OB/GYN to make sure everyone is in agreement and on the same page. No interaction, but you should always make sure that your provider knows all the medications that you're taking. If you have other questions about Prozac or anything else about psychiatry, drop them in the comments. Don't forget to subscribe so you don't miss a single episode about mental health topics and how to feel your best.